Hey everyone, Nathan here, president of Saybrook University. Welcome to another episode of Saybrook Insights. Former colleague of mine and their partner were parents of a child with autism. When he arrived with his family in tow, he introduced us all. I was struck by how amazingly focused his son was with respect to certain behaviors. And of course, we didn't know that his son had autism or was diagnosed with autism. For example, the way the child colored and engaged with technology was mind-bogglingly awesome. Yet this child was also very, very much nonverbal. And this was my real first interaction with a child who had been diagnosed with autism, or a person of any age for that matter. My colleague and I talked for a while about the challenges and joys of raising their child, the hopes they had for him, along with their fears, especially in a society, that really seems to have a never-ending struggle in how to manage differences of any type. For my colleague, he wished that his son would not be seen as a strange outlier, but as really fully human, just like all of us have that desire. And with that, he was hoping beyond hope that there could be ways for them also to better communicate with their son, given the stresses that came with him being nonverbal. Fast forward 5 years, I was chairing a dissertation committee for a student who worked with young people across the autism spectrum. Much of her research focused on the continuum. If I remember correctly, and it's still a little hazy right now, but complete dependence to independence to interdependence related to how these kids connected with their families, their friends, and their community. A byproduct of this research was the powerful themes of many of the kids wanting to be seen as fully human, differently abled, yes, but not discounted or seen as something other than. I admittedly then as now wish I had a greater understanding of autism and autism spectrum disorders, the whole umbrella, if you will, of neurodivergent individuals. However, one thing that became abundantly clear was this concept of neurodiversity. And I was really focusing in preparation for this interview today and trying to get a better handle on it. And I realized there's so much to learn. Enter Dr. Cynthia Palmisano. Cynthia is a Saybrook faculty member in our psychology department. Her background is rich in a variety of areas, including her work with neurodivergent clients, including assessing individuals related to autism spectrum disorders. Her research has included a variety of work with incarcerated populations, recidivism, transgender individuals, and within the field of attention deficit and spectrum-related disorders. I have much to learn from Cynthia. I am so excited by this conversation, and I suspect you'll get a lot from this conversation as well. So let's get to it with Dr. Cynthia Palmisano. Dr. Cynthia Palmisano, thank you so much, so much for joining us today on Saybrook Insights. Before we get started, tell us about yourself, your personal professional history as it relates to your education in psychology, and your eventual journey finding Saybrook University.
I had a little bit of an initially crooked path, I think, finding psychology, but I think we all kind of end up where we're eventually supposed to be. The first year and a half of undergraduate work in Connecticut, where I'm originally from, was convinced that I wanted to be a police officer. So I was doing all the criminal justice background and going on ride-alongs and doing all of these things and loving it. And then I kind of got to know really the demands of the work a bit, including the overnights, including the holidays, including a lot of things. And I was like, well, I love the population. I don't love the rest that goes with the job. I ended up transferring to John Jay College, which is a CUNY school in New York City, doing an undergraduate degree in forensic psychology because I got to keep the exciting part of the population and then kind of blend it with psychology, which had been one of my interests. And then kind of it kept on from there. I attended the California School of Professional Psychology in Fresno, which is now Alliant International University. And it is a smaller kind of professional psychology school where it was just amazing to work with a smaller cohort to really be able to approach things in a humanistic standpoint, and I kind of grew the hybrid version of my clinical and forensic practice from there. I've had the good fortune of teaching adjunct at a lot of different places, including CSPP, including a couple of different universities. And I began at Saybrook a year ago, which was really exciting because it's the first full-time faculty position for me. So I feel like the learning curve has been sharp in the way of just that there has been so many great things to embrace since I've been here.
Well, that's great. I've got about 5 service opportunities I could get you drafted into when you're ready.
I'm getting there, but I've been really fortunate.
For the department chair who might be listening, I was just kidding. So really appreciate that. How did you find yourself, going from New York to Fresno, California? Or not New York, Connecticut, I apologize.
Yes, no, it was right, actually, from undergrad. And so it's really interesting because I've lived on coasts and never in the middle. New England is a very kind of conservative in some ways, approach to things. And of course, California, somewhat the opposite. So it was interesting. But one of the startling pieces that, was just such the wonderful timing with my training was in California when I landed and began doing some case management work when I was in graduate school for housing challenged, dually diagnosed individuals. It was just like mental health was a thing. Everybody had it. Everybody did it. Everybody went to therapy. And it was like, oh my gosh, this is amazing. This is how it should be. I had the pleasure of working in some of the earlier funded AB 2034 programs in the state of California, which you guys have a unique system where there's taxing of certain portions and that tax of certain income portions of people, and then that it's used to fund different programmatic needs. So the first program that I was in, which I eventually became the director for, was absolutely just the best way I could have ever asked to learn mental health because it was just the idea of literally and figuratively going to people where they were at from a metaphoric standpoint and from an actual standpoint, whether that was the park, whether it was out on the ranch, wherever it might be. So my clinical work started there and then evolved to a bunch of different things. A lot of jail and prison and kind of different indigent populations. I was also fortunate enough to always work in private practice at least part-time, and then mentoring students in different capacities as well. So I think mentoring, especially supervising, keeps you really aware of what you're doing and being able to justify your practice and kind of how you do things. And so I think it's been really energizing over the years too.
That's pretty cool. You mentioned that you were in forensic psychology. That was your primary focus area initially, right? And I know you've branched out and around a bit. It sounds like your policing background had probably something to do with that forensic psychology, although I could be wrong here. How did you choose forensic psychology, and how is it different? Because there are those folks out there. I know as my daughter started looking at programs in criminology, a lot of folks are like, oh, you should just do forensic psych. And after she talked to a couple forensic psychologists, she's like, I don't think I can do patients. That's not my thing.
No, absolutely. There's are huge misperceptions. Absolutely. And it's just the media. It's the way that things are popularized. And people also the media kind of looks at forensic psychology and forensic science all as one. And so really true forensic psychology sticks to all of the great skills that we learn in regular psychology, but kind of takes it a step further because you have two things. One is you're using all those clinical skills sometimes with a really extreme population that might be resistant, that might have multiple needs, that might have different aspects of stressors and different things happening, intersectionalities, if you will. And then the additional piece is that the normal rules of confidential, sitting with someone in a therapy room, what's said here stays here, often doesn't apply when you're working in forensic psychology because you might be reporting back to the court, you might be doing an evaluation on a parent who's seeking custody, so confidentiality is very different. And that type of work with that population is not for everybody. Right. You have to kind of understand the differences and be open-minded, of course, because when you're working with offenders, there's some interesting things that come up, but very different, correct, than the perception of like what it is. And when I do teach intro to forensic psychology or have at the undergraduate level, I feel like the dream crusher. That's what my husband calls me because he'll hear me talking to my students and they will come in and just think the path is going to be FBI, right? Like on TV, and that's what it's going to be. And to be a forensic psychologist, you have to be a psychologist first.
Yeah.
So it's different. It's different than people perceive.
Yeah, they're not going to be, doing the analyst stuff that in the profiler and figuring out the serial killer.
Yeah, if it is, it's rare, I'll say, if it is, yeah. But the wonderful piece, and I'm very fortunate, which I think has made the path diverse, is that you are a licensed psychologist first, right? So you're held to the same ethics code in the state and all those aspects. One of the interesting intersections was, I won't even think of the year, and I'll date myself. I want to say it was about early 2000s. Oh gosh, where one of my first assignments in one of the institutions in California was on a transgender HIV positive unit. So when I think about that, and transgender populations are a population that I still work with in a few different capacities, when I think about what that was then, 20 years ago, versus what it is now, is absolutely just unfathomable to me and how much it's changed. And yay for the good. But that kind of brought together a couple of what now have become different interest areas for me. But I've just been fortunate, many different settings, many different populations, but just the enjoying working with people no matter where.
Oh, that's terrific. No, I appreciate that very much. And, I guess I have a connected question on the forensic psychology piece. We had a very close colleague of mine who worked in this space. I guess my question is around, because of the confidentiality pieces, right? And you have a duty to report, and there's all these other complexities within a prison system, incarceration kind of hospital, for example. How do you see, or did you see transformation? What does that look like for an individual who is incarcerated, who's going through the court system? You mentioned dream crusher. Can that be soul crushing for the therapist?
Oh, absolutely. I will tell you, when I moved from this position, most recently, actually, in about, well, recent 10 years as a supervisor in jail to doing full-time private practice, I think I was a little soul crushed. I was a little soul crushed, and my husband very wonderfully was like, I think this is not what you went into it for, right? And kind of where my mental state was at the time, just from being more skeptical, not necessarily from the individuals, but from trying to make change or facilitate change in that really tough environment. At the same time, I would say, again, a couple of different prisons and prison and jail, kind of different environments. Jail more immediate, right off the street, where prison, you're usually sentenced and you're in it for the longer haul. Prison, a little bit different environment to do groups, to do individual, and believe it or not, actually, I would say prison work, especially some of the most rewarding experiences that I've had, because if you can think about someone who has no incentive, and in California there are a lot of life sentences still, that's where the institutions that I worked for a time, so you don't have to go to group. There's no reason to go. It's not going to get you anything. It's not going to get you out early. The only reason to go is self-motivation, right, of whatever kind. And there was a wait list for groups. We did lifers groups, anger management, depression, anxiety management, everything. And the gravity of knowing that someone is there because they choose to be for their own benefit, even if they never get out ever again. That's pretty powerful, right? To sit in that space with someone.
We have some colleagues of yours that did, and along with you, some of that prison work. I think Bob Flax, who is a graduate, did quite a bit at San Quentin, and I remember those stories he used to talk about in terms of the work, and I know there are a few others. So I really appreciate you bringing that up, because I think sometimes we get, either starry-eyed, or it can sound so soul-crushing. It's like, why
Absolutely.
do it?
And there's the motivation there because if you actually, it's kind of a weird way to think about it, but in normal life, if someone chooses to go to therapy, they have the rest of life competing. The kids need to get dropped off, work needs to be, all these other things where, interestingly, when you have a lot of time on your hands and are in kind of an isolated environment, you have time to work on yourself and reflect if you choose to. So the fact that people would choose to for their own betterment at whatever stage was really, really invigorating. I joke about it with my husband. So I have two children, and both of them were in utero the entire time I was working at different institutions. And so we joke, of course, my son is hopefully on the path to being a psychologist. We'll see. The little one, we don't know yet. And so I swear the amount of things that they heard while they're in there is probably like a novel's worth. Both of them absorbed it all in different institutions. So it's kind of interesting piece, but they're good listeners. They're good listeners.
Gives a whole new meaning to "Baby Got Bach." Is that what you remember the baby?
With the headphones, yes.
That dates me as well. So yeah, I think that. Well, this is good. So, for those who don't know Dr. Palmisano, her CV is pretty amazing, and we're really excited to have her here at Saybrook. I was excited to talk a little bit. I know this sounds kind of weird to be excited about, but I'm excited about your work on assessment in individuals. I think, yeah, it's a big part of psychology and other therapeutic professions, right? And yeah, before we get into some of the other details of your work, it'd be nice to hear from you, from someone who does it a lot or has done it a lot, what assessment is, what it entails. And I know for some who are not in the profession, when you hear assessment, it can sound scary. It can sound, well, this is what a shrink is all about, right? I mean, so I'll get all that out there because I think Dr. Palmisano will probably yield some great insights. So
I think it is a very interesting skill set, and it is one specific to psychologists. So when I'm teaching or when I'm in kind of different, academic settings, I encourage newer or psychologists that are kind of on the path of learning to at least get the exposure and the skill set. We have, of course, school psychologists, different people who can do testing, but they're all psychologists. So it does distinguish us from different master's level therapists as well as MDs or other medical professionals. So it's interesting because with assessment, usually, of course, the goal is to narrow or qualify a specific problem, right? And that's great. I wish it was quite that easy all the time, but the nuance behind it is combining all of the other things you spent time learning in graduate school as far as human behavior and intersectionality with different aspects and specific tools around types of assessment. We do a lot of autism spectrum as well as attention disorder or general clinical testing in the office, and then integrating all of that with your knowledge and your just approach to the person. It is intimidating, and it's interesting because we do a lot of it, and sometimes I forget and try to re-remind on a daily basis that when someone's coming in, that's what I'm gung ho. I'm ready. Let's figure it out. Have a seat. We're going to do it. For other people, sometimes it's things they've been putting off for 10 years, 15 years if we have adults who've always thought maybe they were on the spectrum and now they're coming in. Or for parents and for children as the example to sometimes the idea of a label, right, has a very mixed, of course, connotation. And finally facing that, it's very kind of intricate work, and you do have to be pretty good at rapport building and interacting with people because you need to get as much as you can in the time that you have. So it's kind of like a jump in and do it. And I would thank jail and prison work for assisting me in developing that kind of, action-oriented mentality. But it usually is in service, again, of answering some specific question, learning disability, maybe ruling out something. Sometimes we have prescribers that will send people because they want to make sure that they're medicating correctly. And so we do an evaluation diagnostically. So it can be pretty diverse.
how do you put people at ease when they come in for an assessment? I really appreciate how you frame that. That was very helpful, that first part.
Thank you. And if Dr. Jackson does watch this, hopefully she will remember that question. She asked me something similar during my interview for Saybrook. And I said, one of my favorite questions is, what can I be helpful with? What are we here for? What can I be helpful with?
That's very humanistic, Dr. Palmisano.
I think it got me the job. I'm not sure. But it's meant to, of course, I mean, sometimes we do have people that are very straightforward and I want to know if I'm on the spectrum, right? Other times it's like, I don't know. I've been through a lot of doctors. I've been on different medicines. I'm really frustrated. I haven't gotten some clarity. And then we try to go from there, right? But it's much less threatening, I hope, anyways, than me kind of coming in and telling you what I'm going to figure out about you, right? And that translates all the way through from the beginning of the process with like our staff who takes screenings on the phone and, gets people into the system just from a paperwork perspective, right on through, the other end of when we're doing a results session and taking the time to figure out, to make sure that someone understands what we're saying. I think nothing worse than 12 pages of psychological jargon that people can't use. So there's kind of that hopefully start to finish. Approachability will make up a word with things.
Well, I wish we had 1,000 more therapists like you. who felt that
Thank
way.
you.
We're lucky to have Cynthia here teaching our students, because that's going to make all the difference in the therapists that are coming out for sure. You said something here, and this is going to lead us a little bit down the pathway too around neurodivergence, but I'm going to just equate this to probably a terrible analogy.
We'll try it. We'll try it.
We'll try it, and we can always edit it out if we need to, right? I hate going to the dentist, and there's always something wrong. Like, I know when I go in, I'm going to have like something done with my gums or something, this. And I put it off, and then it makes it worse. It's probably a bad analogy to equate your mental health with your teeth. And I'm sure there's some other things that I need to address besides my teeth. My question for you is why is it important that people get assessed? You alluded to this in your initial response, which I thought was great, but I think there's probably maybe just go into that a little bit more about how it can be helpful.
Yes, and it has a few layers, and one of the layers does not jive exactly with humanistic philosophy, but we just need to get it out of the way. So, in our society, with many things, we'll say, for example, either insurance and I do take insurances at the office, a lot of different panels, and I think it's Medicaid in California and Medicare. So, those systems are driven by labels, by diagnosis, right? Also, schools are driven, if you're going to do accommodations, by labels or by diagnosis. Sometimes medication is driven by labels or diagnosis, right down to how I bill a therapy visit. It has to have a diagnostic code if I'm going to bill insurance. With assessment, the same thing. By the end of the assessment, there's a diagnostic label and code that then sometimes is the person's next step towards accommodations, which means, of course, extra support at whatever level. So that piece is an interesting nails on the chalkboard against some of what we teach in humanistic life, right? So it's a very interesting thing to try to bring the two together. I think what my default goes back to is that, for example, especially depending on the family's means, if you're going to pay out of pocket, I'll say on this coast anyways, for an assessment, you're going to pay probably $2,000 to $5,000, right? So that's not accessible to most people. So I guess the humanistic part of me looks at the value in diagnosis as a necessary evil, right? But then also as something actually really important that can drive appropriate treatment interventions, that can get people assistance in the academic environment. And particularly with children, it's not that I'm, of course, in rush for a label, but I will tell you after interviewing adults that have struggled with unlabeled learning disabilities, autism spectrum, attention disorders for 20 years, we'll use your teeth analogy. A lot more teeth are rotten by that point, and we have a lot more issues to talk about with the dentist because we've been carried around some baggage. We've been eating some bad stuff, whatever metaphor we want to use, and that has then all of a sudden there's this reason why my teeth are bad. Oh my gosh, it's not my teeth. It's just my biology. It's just, right, whatever it might be. And that can be hugely relieving for people. And then they, of course, hopefully, can seek out the services to help unpack some of that, of how we got there to begin with. But it is a very weird in between because it does not fit well with humanistic kind of approach with things, but I think we can infuse that into the work that we do and realize that it's part of the gateway for people to move forward with clarity and get the appropriate services.
Yeah, for sure. And I think it's great that you acknowledge that. I also think that I've talked to more and more people like psychologists who haven't been trained at Saybrook or elsewhere who will say, but I actually subscribe to humanistic principles largely, but there are other things that kind of a palette of options that they kind of pull from. And, this is your primary palette, your color palette, for another bad analogy, hopefully not, but is humanistic, and you're kind of pulling from these other tools in your toolbox that you're using, it sounds like.
It does. And I am very fortunate enough again now to work for myself, but to have had in practice, but to have had the time and the space to do that, to see it done different ways in larger systems and being like, oh my gosh, this is not how I want to do this. And then working into this more freedom and more control over how we deliver that in the office.
Well, I want to take a little bit of a turn here. It's probably a big turn. I understand from your background, you're starting to do, or you've done work with neurodivergent individuals, including those with autism and other spectrum disorders. Admittedly, I've sat on a couple dissertation committees in my time talking about where the student was researching autism spectrum. disorders and their work with families. I'll be very candid. I struggled, getting my head around the complexities. A lot of important research and beautiful stories, hearing progress, and also understanding the challenges that were inherent in supporting individuals with autism and spectrum disorders. So I'm excited for this conversation that we're about to have, to learn more from you about this. And really, I think maybe for our audience and for myself, can you describe kind of what neurodiversity is first, and then maybe getting a little more general or more specific, autism disorder, and then kind of the spectrum disorders. What are those exactly? I know we've got like 5 to 10 minutes, but certainly
I'll do my best.
cram 3 years into 5 minutes, Dr. Palmisano.
I will try. Oh, so neurodiversity is this idea which, without pathologizing it, kind of starting there, is that we all have inherent differences, right? In our brain, in the way we process information, in the way we communicate, in our sensitivity to stimulus, right? Or what appeals to us taste-wise. I mean, it really is a broad term. Interestingly, it fits really well with humanistic psychology in that it's like, we're all different. Of course we are. That makes total sense. The contrast of this comes, and it's great that we kind of have the backdrop of talking about it, is that medical model then kind of says, right, but if this is the criteria, thank you DSM, that we view as the norm, and you're outside of that, then neurodiverse kind of takes on this different connotation. You're different. Right? Versus, oh, we're embracing your diversity, then kind of it pathologizes it a bit more. So neurodiversity is not a term itself in the DSM, at least not yet. We'll see. What the typical kind of application of this term was at first initially to autism spectrum or autistic level of functioning. It, we know now, includes a couple of different things, including attention disorders. We have a few different things that fit under that heading, like pragmatic or social communication disorders, a few different things. And up until a couple of revisions ago of the DSM, we had a different concept of autism, which was more along the lines of Asperger's, which was considered like high functioning autism, and then autistic individuals or individuals with autism. So the contrast was interesting because we used to have this, you're low functioning or you're high functioning, right? Kind of idea about things, which are kind of like disparaging words in and of themselves. But the more recent revision, not the 2 revisions ago, the 5, I apologize, dropped off the idea of Asperger's, and everybody's just on the spectrum. So I think while in theory that was a good idea to just kind of put these behaviors as one and kind of have it be fluid, it became really a kind of a stepping or a hurdle, I should say, in people getting diagnosed, because then it was like, well, when we think of low functioning autism, someone who's maybe nonverbal, well, I'm not like that, right? And then the conceptualization of Asperger's had disappeared essentially. So I think in the last, I'll say 5-ish, I'll be ambitious years, it's shifted now where people, especially younger, 20-ish year old individuals, kind of, yay, internet, have kind of looked at this and kind of accepted more readily that somewhere on the spectrum, I'm somewhere on the spectrum without the same negative connotation. So the tools that we've used to assess have sort of caught up. We have a little bit more catching up to do, where we're trying to really accurately make what our diagnostic lingo is and the tools that we use to kind of evaluate people and our knowledge all match up. We're definitely not there, but we're getting closer. And I feel like I veered off too as a general idea, but a few of these different disorders can be considered under the heading of neurodiversity. Commonly, it's usually an attention disorder or autism that people think of.
I want to rest in this space of, or this discussion around autism for a moment, and spectrum. So when you say spectrum, I want to make sure I understand correctly. And it's kind of hard, right? Because we're not trying to create levels at this point, right? We've removed the high and low functioning from or we're working to remove that from our language. And the idea is that across the spectrum, you might have attention, is this fair to say, attention deficit disorder, autism, and there's all sorts of shades of that neurodivergence. I mean, I'm probably getting that all wrong.
No, I think you're very close. So when we consider spectrum, we would most likely, that would be autism related. And so that could be a whole variety of different functioning levels. Yes. Other things, neurodiversity is almost like a larger umbrella. We need a visual aid, a larger umbrella that has autism branch, attention branch, and all of these other branches, right? Like different learning disabilities or different aspects underneath. Autism typically is individuals who have challenges socially, challenges in processing stimulus and input, a few different other aspects as far as difficulties maybe with social cues and perceptive thoughts or kind of rigid thought patterns. Interestingly, and you kind of alluded to it, the reason why these things are all under the neurodiverse umbrella is because there's overlap. There's absolutely overlap with what we would see in an attention disorder and with an autism spectrum disorder in some ways. Same thing with other learning disabilities. So if we had the giant Venn diagram, there would kind of be that section in the middle, which gives us a nice kind of shared commonality, I think, for people.
Yeah, for sure. It just strikes me as so helpful to understand that. A very, very close colleague of mine back in the days of Ohio and the Midwest, his little boy was diagnosed as nonverbal autistic. And yet this kid had the capacity, ability, and this is where, my own biases, my own ignorance in this space, he could manage technology in a way that was wicked. I've never, wicked in a good way, right? I mean, it was just the way he would interface, the way he could almost communicate in a different fashion. And his dad often, as we were talking, he introduced his son to me at one point as saying, "This is my differently abled son, and here's what he can do." And then he said, he's been diagnosed as autistic, and low functioning was used, but he didn't mess around with that frame too much. So how does someone who, in today's society, right, you kind of alluded to this, what does the diagnosis mean for the individual who has or is diagnosed with autism or autism spectrum disorder? What does that look like maybe it's not the poles, but on that spectrum? What does that look like?
Absolutely. And if we had another 10, 15 minutes, I'd talk about gender differences as well, because there are large ones. With women with spectrum disorders, there are different, still, of course, societal interaction, social patterns, right, that women engage in that men don't exactly, of course, and there's different expectations socially. So we find, kind of answer to your question with women is the example that even, or oftentimes when an adult woman is getting evaluated or thinks that she's somewhere on the spectrum, there's often already comorbid conditions like anxiety and depression because there's been an extended period of time where through high school, through college, we've been wondering, why can't I just fill in the blank, fit in with everybody else? Why don't I get it? Why is this so hard, right? There's a lot of other aspects that come to bear. So a lot of times, frankly, it's a relief. I've seen people just be relieved with the validation of me saying it, of someone who's got some official, whatever, knowledge, kind of acknowledging that and then talking about what it means. Oftentimes they've done the research, and of course, Dr. Google and Dr. Internet, we battle against that, but they come with an informed understanding, and then this is often the validation that kind of gives a label to that. That might be for purposes of accommodations like things at work, like maybe stimulation breaks or noise canceling headphones, things that are very small adaptations but very important, right, to people. Other times it might be for just self-education and knowledge. And interestingly, one of the biggest things, I was just reading this for one of the courses that I'm designing, is the internet has been the best tool, that was how it was quoted, for people on the spectrum, because now I can connect with someone just like me 300 miles away, that gets it as well. And we can chat and we can talk and we can feel much less isolated. And of course, as we know, the internet removes some of the social nuance of communication, which a little bit less stressful depending on your social abilities. And it's just a great opportunity to connect. So I think the commonalities, as well as then as part of the assessment process, we take pretty seriously making recommendations that are individualized and informed. So it's not just here's your diagnosis, good luck. We take the time, and we luckily have a wonderful team to kind of say, what can we help you with next? Is there a therapist? Do you need a provider? Here's what young adult resources look like in this area. And Connecticut is the size of Tulare County in California. So we're fortunate we know most of what goes on in the state. But, it's been wonderful to give people that validation if that's the case. And I think it's just, again, that next step, right? It's something that you've been carrying around in this satchel over your shoulder that you can't quite see and you're not sure what's in it and why it's so heavy. But then all of a sudden it's out there, right? We still have it. but now at least we know it's in there.
Yeah, and in figuring out, I think we're supporting that individual in the process of what is it going to take for me to adapt, right? As you mentioned already.
Or if we go the humanistic route, to help others adapt to what I need, a little bit of both, right? And so it's very interesting, and there's a lot of great energy around the language, of course, as you know, and how we refer to abled versus disabled, and neurodiversity is definitely part of that. So I'm excited to see that evolve as well.
I appreciate that so much. It's an area in my own life that I work on daily, and I think for all of us, you've given us some really important perspective to think about in this space. We're not going to be able to give this last question. Well, in fact,
I'll be quick. I'll try.
no, this whole 45 minutes has gone by way too fast, and it's like 3 or 4 years we could talk about this stuff, and you do such a great job of like talking about.
Thank you. It's been fun.
So, I'd like to talk. We're going to get into the kind of well of transgender topics, right? And for just a moment, and we're going to have you back because I think this is such a
Oh, I would love it.
yeah, I think it's so timely right now in what we're managing as a country. It seems like, of course, we're talking about this, and I think we're talking across each other in the country with respect.
There's a lot.
I guess right now, rather than getting into the politics of it all, because there's a lot about that, maybe talk a little bit about how we can better support trans youth and trans individuals who are really working to manage all of this stuff that's going on right now.
Absolutely. Okay. I think, quick aside but related. So there is a lot of co-occurrence of other mental health symptoms, including actually spectrum disorders with trans individuals. So, but I'll kind of leave that for a minute. So there's also lots of different ways, unfortunately, that trans people have been marginalized, right? That might be the sign on the bathroom door. That might be the gender pronoun at the end of the email, right? There's a lot of different ways. And I think when we talk about either on a micro kind of individual level or at a larger level, how we can support trans people, I think a great place to start is to ask. And I know that sounds really basic, but we assume, we all do, that's our lens, right? That this is what will be helpful to you. If we can, whether it's people in our life or different committees or subcommittees, within the places that we work. And of course, that's not making anybody the only representative, but helping us be informed actually by the population of people that we're looking to address is ideal, right? If we can. And I think that can come also at a very micro level within the environment with each of us that we're in, as far as things like asking people, how would you like me to refer to you? That's my favorite because it's very simple, it's very respectful, and it gets it out of the way. Right? How would you like me to refer to you? For report writing, we do the same thing. We talk about what pronouns a person would prefer and kind of how they'd like to be addressed in the report. I think another way is just considering the different things for that person, that if you are a non-trans person, things like using the restroom, things like leaving somebody sitting in a very large waiting room for a long amount of time with other individuals that might not be so comfortable for them, right? Versus staggering appointments by 5 minutes and kind of getting people in differently so that if someone's uncomfortable, they're not sitting out there, right? So some small things that we do in the office. We in the office also have some different trans symbols and flags kind of that are openly posted in the office to kind of demonstrate outwardly that we are allies and we're supportive with the population. So I think those types of things, and just really for all of us, rechecking that lens, right? What we assume about people, what we assume is helpful. But I would say, and I do wish we had another hour to talk about it, one of the things, particularly with youth, I'll say in Connecticut here, we are super fortunate. We have trans-informed providers. You can access care for your children if that's what you'd like to do, without worry about some of the other things that we know are happening in the country. And really the biggest thing with parents, I would say, you don't have to get it all. You don't even have to like it all, but you just have to take a step towards supporting it, right? It's time. It takes time. Just because when a lot of times when kids come out, and if that's, they're disclosing to parents, they've been thinking about it for a long time. This is not new to them. This has been percolating, or they've been talking about it, or they've been on the internet about it. I think that the challenge, of course, for parents, and we would assume most parents, of course, want to support their children, is that I've been percolating this for a few months. Now I'm telling you, and I expect you to be on board. Here's my pronouns. Here's my name, right? And we will get there, absolutely. But there needs to be sometimes someone to help guide the family, of course, towards everybody getting their needs met, but realizing that it's a process. It's a lot on families. But I love to assume, at least that families, of course, want to be supportive. They just need some guidance in how to do so. But it's so important. Very high rates of suicide, very high rates of depression and anxiety with trans youth that aren't supported. Interestingly, there was a California study not that long ago that a huge portion of youth in the foster care system, particularly girls or cisgendered girls, are transgender. They end up in foster care in higher rates or being rejected by families. So there's a lot of support needed in different ways.
Yeah. Oh my gosh. Yes. An hour or 2 hours on this topic alone.
Definitely, definitely.
And it is so vital, everything you say. And for those who, I took the step of downloading the Trevor Project. Has a whole. It's a very easy to read workbook for adults like me.
I love it.
It's quick and it's an easy read, and you hit on all their points, especially around common respect for the individual. And again, these are things that I am, I'll just own this for myself. I just charge in and make assumptions. I mean, even in this interview, I made assumptions, right? And I think really it takes me back to my grad school days when I'd walk into an office and refer to someone as by their first name or as Ms., right? And it's like, or Mr. It's like, I'm doctor, and here's who I.
Oh, and there's the secretary.
And I'm like, wow, I just learned something massive there. I think it goes to that very basic piece, but there's so much more to it, as you rightly noted, and really appreciate you bringing and shedding light on that.
No, it's my pleasure. And there is so much, to integrate. And as future psychologists, when we're working with students, it's like, oh, they know so much more than we knew. And I'm glad. And I think that's every generation, right? But I feel like, and it's our professional, personal, all of the above obligation to be informed, right? And to keep up with this. And there's a lot to keep up with.
So everyone hang in there and keep doing your reading and your work.
Yes, absolutely.
So two takeaways. So two quick takes.
Don't overthink.
You're not being graded, really. So what I'd like to ask you first is, what does the term humanistic mean to you, Dr. Palmisano?
Ooh, the quick answer, meeting the client or the person where they're at from a very literal and a very figurative standpoint, right? If we're here to address this, even though I'm thinking, oh man, you really need to address this, it doesn't matter. I'm not doing my job, right? Where are you at? This is where we're starting. And sometimes that's very literal depending on the population. Other times, if I don't assume, that's like our word of the day, and kind of cast that off, I can allow the person to inform me. The other piece would be the strength focus, and I do some positive psychology as well. It's such a refreshing thing to think about what's right with people as opposed to just what's wrong with them. So that's the short answer.
That was very good. I think you should work at Saybrook full time.
Oh, thank you.
That's the bar for entry, right? So, no, very good. That was fabulous. All right. What are three takeaways someone can do to improve their mental health right now?
First one, so simple. Move. Move your physical body. Walk, get up, take a lap in between what you're doing. Go sit outside and talk with a friend or make that phone call outside. Move your physical body. It helps how we think, it helps how we feel, it keeps us in shape, all that great stuff. That's the small one or the easy one. Second one, I think, would be when you are going to change something, right? We all are great for being like the New Year's resolution. I'm going to be fit, right? From years and years, I will say, of working with people, there's nothing worse than we want to hear is the you're going to big, huge general goal. It is much easier and much more satisfying when we set our mind around something specific. I am going to raise my fitness level to X over the next 2 weeks, right? So if you're setting yourself up mental health wise to be less depressed is great, but what does that actually mean to you, right? So whether it's for yourself or in treatment, when you set those goals, be specific and narrow. We're more likely to have satisfaction and we're more likely to actually hit those goals. Okay, third, and this one is pandemic, probably would have been the same, but more important now. Really the ability to connect and be present with other people, right? We're so caught up with everything and then some. Pandemic kept us so isolated in so many different ways. So there's a neurochemistry to how we literally fire, our brain fires when we're physically present and attending to people, all that good stuff, dopamine and all the other brain chemicals that are going on. If we make the time to do that, whether it's your posse or whether it's your one person that's your bestie and that's what you do, that's fine. But really taking the opportunities to connect and be present, focus people with people that you care about. Often. I'll say often.
Those were gold. Yeah. So the guests I had before had a golden 3. I think you're platinum.
Oh, you're going to need to write a book.
I think I might. You were fabulous, everyone. Dr. Cynthia Palmisano, who is our Saybrook faculty member in the Department of Clinical Psychology here at Saybrook University. We are so pleased that she has joined our faculty. We're very lucky to have her. Talking about today neurodivergence, autism, spectrum disorder. We got into a little bit of transgender youth. We have much more to talk about. We are very, very, very excited to be engaging in that conversation in the not too distant future. Cynthia, thank you so much. I hope you all enjoyed Dr. Palmisano as much as I did. Remember her 3 major takeaways for improving mental health. Get out there and move, walk, get up. Second, set a specific goal in a manageable time frame. Make it specific and narrow. So if it's fitness, don't just say, I'm going to go get fit, but really identify how fit you want to be and make it a time frame that you can commit to. And third, connect and be present with other people, whether it's your family, your friends, your colleagues, whatever that is, connect and be present. If you want to see the video elements, we've created these segments. Please visit our Saybrook YouTube page. And if you'd like to support the podcast, go to Apple iTunes and leave a 5-star rating and review and subscribe so you can get episodes as they come out. If you like Spotify, leave that 5-star rating and make sure to follow us. You can, of course, subscribe to us on almost every major podcast platform, including Google, iHeart, Stitcher, Pandora, my favorite, Pocket Casts. Remember to check our show notes out for information on today's guests, including links to websites, books, etc. And for more about our psychology programs or the university, go to www.saybrook.edu, click on areas of study at the top of the page, and locate the program to learn more. Or simply Google Saybrook University Psychology. Thanks, everyone. Take care and be well.